Welcome to a very special presentation of the Fearlessly Fertile podcast. IVF isn't the solution you think it is. A brave conversation with Dr. Zaher Merhi. Loves, I'm so excited to be bringing this really cool conversation I had with Dr. Merhi to you because he said something that really caught my attention and I think so many women need to hear. IVF isn't the solution that you might think it is. So many women are being pushed and shoved and corralled immediately into IVF without considering two massive things: mindset and what's really going on with your body. The mind and the body are working together, and it's just too easy to just push IVF on women without asking the bigger questions. Where's her mind at? And truly, where is her body at? And Dr. Merhi is fantastic because he is OCD in the best possible way. He's looking for real solutions. And in our conversation, he's going to be sharing why IVF isn't exactly the solution we've been led to believe. He likes to look in the places that most don't. So I hope that you take so much value from this incredibly courageous conversation that is really freaking fun with Dr. Merhi. And I have all of his contact information in the show notes. Here's my conversation with Dr. Merhi. Okay, my beloved Zaher, I wanted to have you on because you made a video last week that really caught my attention and I think is really signaling a seismic shift in the fertility community. And I really believe that what you were sharing is both basic and brilliant at the same time. And
Thank you.
it is this idea that, look, IVF is not the answer for everyone. So let's talk about what inspired that and really what you mean when you say that.
Okay, you probably, I'm crazy doctor. You probably won't see a lot of fertility doctor telling you don't need IVF. And when I tell patient you don't need IVF, look at me like, you don't want my money? I'm like, no. Sorry, but not about. But what I'm trying to say is this: we've helped a lot of women. First of all, I see a lot of patients who stressed out. And let me tell you one thing, and this is something pertinent to you. Do you know how many patients I just talk to them and after the consultation they get pregnant naturally? I swear to God. I swear to God. Not because no, because they have been exposed to a lot of negative things. And I can tell you the brain half of the game. And now I, joke with them and give them, things that could be done and they feel like, you know, and that significantly help pregnancy. That's one. Now, the second thing that I want to talk about is I see a lot of patients who had IVF before and who had miscarriages before, and now they can't even make an embryo. Let me ask you one thing. If someone is getting pregnant and having miscarriages, it means naturally she ovulated one egg that was mature, that fertilized, they made an embryo for blastocyst to stick, they made it to the uterus, that stuck, but she miscarried. Fair?
Fair.
They tell them now you need IVF, they pump them with high doses of shots, 20 eggs, now they don't even make one embryo blastocyst. That was not her problem. The problem, she was making blastocysts naturally. Now she can't even make blastocysts. I tell her you need donor egg because the high dose of drugs, whether people like it or not, it's actually bad for egg quality. The issue is her uterus. If she's having miscarriages and the embryo were chromosomally normal, the issue is uterus. And I can tell you the uterus is very, very, very under evaluated in our field. Out of 100 hysteroscopies I do to look inside the uterus in women who already had previous hysteroscopy, 99 out of 100 I find something that I fix that could be causing miscarriages or failed implantation. So, no offense to anybody, I'm not saying I'm better than anybody by hysteroscopies, but I really think you need to be very OCD. I always describe my hysteroscopies as, okay, the uterus is a room, and if you come clean my room, I'll find the spot that you missed just because I'm pain in the ass. This is how it should be because you're dealing with embryos microscopic. So if I can see a little scar that was left, That's a huge deal for the embryo. That's the only thing what I said the IVF is not even the. I see patients all the time can't get pregnant. They do IVF, can't get pregnant. They need the donor egg, not get pregnant. All of it long. If the uterus is not receptive, IVF, whether you put donor egg or someone else, it's not going to stick. So that's why I said IVF is not always the answer. And I can tell you, a lot of my patients, I would say 20% of my patients that I helped get pregnant is without IVF.
Not
And I brag
surprising.
about it. I brag about it all the time. I do.
Well,
Because
because your goal is for women to come home with a baby, IVF or otherwise.
if I can tell you how many patients they have low AMH and they tell them you need IVF because you have low AMH. They have irregular periods. And by the way, I asked 10 fertility doctors if a woman have low AMH and low ovarian reserve and she's having regular periods, why low AMH is a problem? And nobody could answer it. Tell me, nobody can answer why a diagnosis of low ovarian reserve causes infertility. Ovarian reserve is the quantity of eggs. If I have not a lot of eggs on my fridge, but I every month I'm eating one egg because every woman release one egg, right? I'm not starving because I'm still similar to someone else. The only problem is I run into earlier menopause or run out early of eggs, but it's not a diagnosis. Someone needs to explain to me. AMH is reserved. If I have very low AMH, 0.02, but I'm having regular periods and I'm not getting pregnant, sperm is good, tube is good. It is implantation. It's not the AMH. I'm releasing an egg every month. What does the AMH have to do with the diagnosis? Because the AMH doesn't tell you quality of eggs, it tells you quantity. But I'm releasing an egg every month. No doctor was able to answer me. So, what I'm trying to say is a lot of patients who are unexplained infertility or they label them as low ovarian reserve end up having implantation problems. And I see this all the time, all the time. But call me crazy.
Well, so what do you think some of the implantation problems are? We talked about issues in the uterus, right? Scar tissue, things that you find with your OCD hysteroscopies. Like, what else do you think can be interfering with that?
Okay. Look, first of all, when you put perfectly genetically normal embryos or an embryo coming from a donor egg, it has at best 70% of chance sticking. There is a lot of people, you put more than two embryos, they still don't stick. Those patients, we call them recurrent implantation failure. Now, why not perfect embryo doesn't stick? Because the uterus is not receptive. They always measure the lining and they say your lining is fine, it's the embryo. That's not true. There is something called endometrial insufficiency, similar to ovarian insufficiency. You can have thick lining, but it's not sticky. Who cares? So if I have thick lining, but it's not sticky, it's not going to stick. I describe the uterus as a room. I like this example. You need the room to be perfectly shaped, no spider webs in the corners, no scars, nothing. Two, you need the paint in this room to be sticky. Three, after I stick, the walls should not attack me as an embryo if the mom has immune issues. I don't care if they say I don't believe in immune issues or not. I really don't care what people say. We see it. Ask Jessica, my nurse. 70 something percent of patients, we treat their immune stuff and they graduated. We just actually had the first baby delivered today
I'm
from
so
since I took over Braverman Reproductive Immunology. Look, so one hysteroscopy to make sure the serum is good. Two, there's a lot of lining have stickiness problems. So what we do for those, you can either do PRP infusion, which is platelet-rich plasma. You take blood, spin it, and infuse it before the transfer if she's doing IVF. Or if the lining have been tired, what I mean by tired is you see women who had miscarriages, termination of pregnancies, C-section, multiple DNC, all this It causes the lining to get weaker with time, and the quality of those cells is not as sticky. We do for those patients, we actually inject PRP in the lining. The inject by hysteroscopy. When you inject platelet rich plasma in the lining, let me tell you what it does. It activates stem cells of the lining to grow and become new lining cells. The period have stem cells. Give me your period now. I can extract stem cells. And there are something called menstrual derived stem cells. Google it. I can take those stem cells because they're coming out of your lining, put them anywhere in your body, and I can help you restore your tissue. So if I inject it in your liver, they can become liver cell because now they live in the liver. Yes.
Wow.
Now inject the PRP with the lining, you activate those stem cells to become new lining that hold the pregnancy better. Basically, you're painting that uterus with fresh paint. So that's two. Three, now you need immune issues. The embryo is half you, half your husband. So the half coming from your husband is foreign to your body. So if your body is hyperimmune or you have a lot of inflammation, your body, yes, can attack those embryos because it's foreign. It's like kidney transplant. If you get kidney from somebody else, even if it's a perfect match, you get immunosuppression for the rest of your life, so your body doesn't reject it. Now, luckily, pregnancy is not for your whole life. It's only 9 months, but the first trimester is the most important because this is when rejection of the embryos happen the most before the placenta take over and stuff like that. So you give them immunosuppression. It's not as severe as kidney transplant, but you give them immunosuppression, and then you let them go in the second trimester, and you take over. So um, we're seeing more and more people with inflammatory issues because we live in an environment full of shit. Excuse my language. We eat
No, it's
shit,
true.
we eat shit, we breathe shit, we put in our body shit everywhere. Make soap has chemical every day. You read them, chemicals. Oh, arsenic acid, lead. So women now they have more inflammation, and that's why we're seeing a lot of even men. That's why we're seeing more infertility now. Is 1 in 6 couple have infertility. A decade ago is 1 in 12. What does that tell you? The environment, and I'm talking about same age group. If you look at women in their 30s, now there's double the infertility because of environmental factor. Well, what else could it be? Can someone explain it? So nobody talks about it. The government doesn't talk about it. They don't do anything about it. I think it's a pandemic that nobody talks about. And listen, if you speak to venture capitalists, they love to invest in infertility because they know infertility is increasing at least by 10% every year. They
Yeah.
do.
Well, the CDC just said 1 in 5.
There you go. So what I'm trying to say, Roseanne, is the body is really, you need some type of immunity to protect yourself, or your uterus needs to protect you from getting infection because the uterus is exposed to the vagina, and this bacteria, if it goes up and if you don't protect yourself, you'll have sepsis and you die. So, right. But if it's too much, now you're attacking your own embryos. So you need some inflammation and some anti-inflammation. If this balance is not good, it can cause failed implantation and recurrent miscarriages as well.
Do you see this relating to, because tons of women that come through my practice would, that many of them, like, it's interesting to me to think that even thyroid function can be involved in this. Do you see that as playing a role as well?
So, thyroid function, there's a lot of immune issues in our body. Thyroid is one of the most common in women. If you test antibodies, 40% of women coming to fertility clinic will have positive antibodies, believe it or not.
Wow.
Now, a thyroid issue doesn't always indicate you have autoimmune issues in your whole body, but it is associated with autoimmune issues. Now, women with ovarian insufficiency or premature ovarian failure in the old term, I don't like to use this term, which is women in menopause before the age of 40, they're more likely to have thyroid issue, adrenal issue. Absolutely, it's indicated to measure their adrenal antibodies and more other autoimmune issues, psoriasis and other stuff. Why? Because their body is kind of attacking itself, and that's what happened. And they have also a lot of ovarian antibodies. So there is a relationship between thyroid and other autoimmune issues. And yes, it
Wow.
is super common.
It seems like in addition to the shit that we're breathing, the shit that we're eating, the shit that we're consuming, like mentally, like I mean, it just seems that we're also in a heightened state of stress and fight or flight. And I talk to women all the time and I say, look, this is something that needs to be addressed because when we're looking at fertility, we're looking at whole health. We're looking at all of you, and what's going on up here is playing out in your body. Like these things are connected. But I think this is one of the most difficult things. I mean, because to your point, IVF isn't the answer for everything. I think a lot of women think in the back of their mind, "Oh, I'll just do IVF and I'll address the problem." But it's like what you're saying here, and what we've been talking about for a long time is like that may not be it. There could be so many other things going on that by not
Look,
addressing them, like you position yourself for failure.
yes, and that's so true. Look, if you look at any statistics in any clinic at any age group, let's say younger patients doing IVF, the pregnancy rates is what? 50, 60% at best. So this tells you by itself that IVF is not always the answer. A lot of those patients don't make embryos because they've been exposed to high doses of shots. So I can tell you, the conventional IVF, 50% of women do worse on the high dose than better. That's
Wow.
one. Two, their issue is not the egg. They always blame it on the woman's age and egg and egg. It's really environmental factors. So, statistically, if IVF is the answer, you'll have 100% of women in their early 30s get pregnant, but it doesn't happen. It
Right.
doesn't. So, there is a lot of things that I think we need to work with. We live in an inflammatory environment. You're going to see more inflammation. You need to lower body inflammation. You need to lower the stress between the tariffs and people stressed out about the economy and inflation, and there's always drama. That causes stress. And between stress and inflammation that we work in, if you don't really tackle the problem, even if you do IVF, you will not get pregnant.
I'm glad you said that because I think we see there's more and more data out there coming out about the role of inflammation. And we have so many sources causing that inflammation, as we've discussed, that I think anyone who is serious about having fertility success has to take this seriously. Both the external as well as the internal factors creating that physical stress, the mental stress, all of this. That if you want to set yourself up for success, you can't just lean on IVF and hope that it's going to fix you. Because based on what we're talking about, there's no guarantee there.
Look, Roseanne, inflammation is 90% of diseases that we have is inflammation. I'm going to tell you, endometriosis is inflammation. PCOS has chronic low body inflammation. Aging is inflammation. What does
Yeah.
arthritis mean? It means inflammation of the joint.
Inflammation.
What is Alzheimer? Inflammation of the white brain. Tell me one thing that's not related to inflammation. And egg quality is inflammation. The whole ovary gets inflamed as we get older. And that's why, if you lower body inflammation, you can improve the egg quality. Same thing for the uterus. If you give anti inflammatory, you're more likely to carry a baby, especially in the first trimester. So, yes, inflammation is everything. Plastic causes inflammation, you name it.
Well, I was going to ask you, like, along the lines of inflammation, like, if you're doing all of these high dose, like, super hardcore treatments and you're not taking a more individualistic approach, because I've heard from so many women, and I went through it myself, where it's just hammer you with like the highest doses of everything to try to get as many eggs as they can. I mean, that's got to cause some inflammation and residual inflammation as well.
I'm going to say something that probably a lot of doctors are going to hate me right now.
I
And
love
guess
it.
what? I don't give a shit. Stop giving high doses of drugs for women with low ovarian reserve. Medication does not create new eggs. It's food for those eggs. Stop it. I see people $10,000 of drugs and they develop one follicle. She could have developed the follicle by herself without 10,000 of drugs. They don't create follicles. It takes 90 days to develop a follicle. So pumping with shots, unless you want to pump someone for 90 days, you're not getting more eggs. Stop
Wow.
it. I'm serious. It pisses me off. And they give them Manipure, and Manipure is made from women who have high FSH and LH. Pee in a cup, I can make Manipure. Why do I have to give you Manipure? It's just they need to stop it. I really mean it.
You did a video on that recently too that I saw, and I was
People
like,
got pissed. I don't give a shit. I really
yeah,
don't.
no, no, but that's so interesting because like Menopur is something that like it's just it goes out like crazy. People just
I'm not against Manipure by any means. Not. You could use it. However, if someone is young and their body is tolerate those, Menopur is like you're punching someone on the stomach. If you punch me on the stomach now, I'll vomit. But punch me when I was a kid, I'll bounce back. So the tissue is different as we get older. You can't give them high doses of shots and hurt the egg quality. There's plenty of study. People say the high doses doesn't affect egg quality. There is science. There are plenty of study. It's a fact. The high dose of drugs is bad for egg quality. Fact. There's not nobody needs to negotiate anymore, right? So look, the follicles. I always describe it to my patients. What protocol you're gonna give me? I don't know. We just met. I need to see what your body has, and then I'll give you what you need. If you have one follicle, I'm not giving you anything. Your body is gonna grow it anyway. Yes. So what's the purpose of the drugs? Between one and three follicles, half a pill of Clomid is enough to feed three of them. So the drugs is food, and follicles are like people. The more follicles people there is, the more people you want to feed, the higher the dose. So yes, I do conventional IVF. If you have 40 follicles, I'm giving you conventionally because yes, the more medication you give, the more eggs I get. But if someone has only two follicles, it's not the more medication I get, the more I get. No, you're getting two no matter what you do. Don't overfeed them. You're going to hurt the quality of it. Let me explain to somebody, if doctors are listening, the medication I talked about yesterday, the follicle has two mouths, one FSH, one LH. Follistim, Gonalef is FSH, Menopur is LH mostly, right? If you give a lot of medication, and I'm going to explain it to people, those mouth, which is called receptor, becomes downregulated. It is studied in med school in 101. When you have, they shut down and the receptors hide, it's called downregulation, then the follicle dies. So actually, the more medication you give for women who have low ovarian reserve, the more you're killing follicles and you less they grow. I hear everybody, every patient, everyday patients have like, oh, I had five follicle. By the time I got retriever, I had two or one. I'm like, it doesn't. So look, I'm not saying I'm better than anybody. I think we need to customize IVF. I don't believe the conventional way works, not because I don't believe the statistics don't lie. Only 50, 60% max in younger patients get pregnant. That tells you the drugs. But I see it every day. I'm going to give you two examples, Roseanne. And if those two examples don't convince you that the IVF drugs are bad, come and shoot me or punch me. I see patients every day who are doing IVF for gender selection. They have four girls. They get pregnant every year, right? They want boy. Now they do IVF. They give them so much dose. Now they can't even make one embryo. Wait, I see it every day. That's not their problem. They make embryos naturally and they get pregnant. They're just doing gender. That tells you that the high dose hurt the egg quality. They can't even make an embryo. Second is patients who get pregnant and have miscarriages. Now they can make an embryo on IVF. That's not their problem. They're getting pregnant by miscarrying. So what I'm trying to say, those two people, and I can tell you half of my patients is one or the other, tells you by itself. Look, I'm not against conventional IVF, but it doesn't work. Change it. Einstein said if you do the same thing and expect different results, you're stupid. I see patients that 4 cycles of conventional IVF. How many? Follistim and Menopur. Oh, they added Lupron Flare. It's still a high dose. The food for the egg is follistim, LH, and F. If you're giving the same food to somebody and they're telling you that you don't like it, change it. That's all I'm saying.
Wow.
So I'm not against conventional IVF, but to do it 4 times, same thing, I'm sorry, talk to Einstein, he'll tell you what you are. But I'm not talking about patients, I'm talking about doctors. Like, it's time to change. And I'm probably, a lot of doctors might hate me. I'm sorry, guys. I don't mean it in a personal way. I'm talking about the whole field. It is, look, there is 16 iPhone. Why we still have one version of IVF?
Yeah.
99%. It's
Well,
time to
and
change that.
that's so true, Zahara, because I mean that's the thing is like if you're going to get treatment, why would you go to the McDonald's of treatment? Why wouldn't you want to go to a bistro that is going a boutique approach that's going to be taking you into account, taking your unique situation into account? Because what if IVF's not needed at all? Just like what you were saying before, what if there is some other issue? I hear this day in and day out in my practice. Women are being told, oh, you know what, you're over 40, IVF. So many women come to me with this idea, and they have actually created identity around, well, I can't get pregnant unless I use IVF, which is garbage. I mean, we just had a woman come through my program, 48, pregnant naturally. Like, how do you explain that? Like, it happens.
It look, women have good eggs and bad eggs at any age group. Okay. I always describe the egg, the ovary as a lake, and the eggs are fish. You're born, you have a lot of fish, they're all healthy and happy. As you get older, some of those fish get older, you still have some fish. There is no way all these eggs are bad. That's why you hear about 55-year-old in my village in Lebanon, all pregnant naturally. We heard about those all the time. We hear them
She's
every
probably
single.
eating good food too, though, Zahir.
I
She's
know.
got that good Lebanese food. She doesn't have glyphosate all over it.
But look, what I'm trying to say is, look, my problem with the fertility world is, number one, as fertility doctors, 99% they have ego. And they're always bad mouthing others. I don't like that. We're not here. We're here to help each other. And it's okay if someone does something outside the box. Don't trash them. I was trashed by a lot of people when I started PRP 8 years ago.
And look at you
Now half
now,
of the
baby.
now half of the country does PRP. Now most of my patients come, I did PRP, didn't work. Well, granted, not everybody knows how to do it, but what I'm trying to say is this: why don't we be open-minded to things? There's plenty of research and science on other things, on adipose stem cells, umbilical cords. Why not try it? Why do we do studies and spend millions of dollars if we're not gonna? Why? The ASRM, oh, we have stem cell grant. Well, great. If I have the grant and I publish the research, but the FDA doesn't allow it, what's the purpose? Can I ask you? What's the purpose? The FDA doesn't care. They don't care about women reproductive system. We're behind. MRT, or mitochondrial replacement therapy, is approved in many countries except here. We're behind. Go apply to the FDA and say, I want to do MRT. This is my protocol. You know what the response would be? We don't have a committee to review your application. Excuse me. We're America. We're the strongest country in the world, but you're telling me the FDA doesn't have. But if it's a vaccine or something else that brings money, yeah, they would have committee. Look, it pisses me off a lot.
Should. It should. I mean, women's health here in the United States is atrocious. And I tell women all the time, I said, hey, you think the fertility stuff is bad. Nobody's even talking about perimenopause, menopause, things like that. Like women are understudied and underserved.
I cannot agree with you more. Look, Roseanne, they teach, I think, and I did this interview with Washington Post maybe 15 years ago. They teach us in school, high school or middle school, I can't remember, about safe sex and condoms. Yes. But this is when the education about ovarian aging should start. This is when we should tell patients, the students, you need to learn that eggs you run out, or the quantity quality declines in the 30s, whatever, and then you might go into menopause. A lot of people don't even know what menopause is. Should start there. That's one. Two, pediatrician at the last visit, 16 years old, you're not graduating from the pediatrician to the adult primary care doctor unless the pediatrician check a box that they discussed ovarian aging, a potential egg freezing if someone's still not ready, and finally menopause. Three, mothers have to start talking about to their daughters about menopause. It's not a taboo. We should not be embarrassed to tell a woman, I'm having hot flashes because I'm going through or what menopause is, or what effect it has on your brain, on your vagina, on your things and other stuff. We need education, and this way, because 90% of women that I see didn't even know that egg freezing was an option because nobody discussed it. Fourth
Wow.
things, OBGYN doctors. We don't see patients right away. OBGYN doctor doing pap smear. They really must discuss. Are you interested? No? Okay, just want to let you know egg freezing is an option. That's all. What's egg freezing? Well, then at least they can give them some pamphlets. So if we do this, we solve a lot of problems, right?
Yeah.
And
Well,
this way, mentally, the patients won't be stressed out to find a man. They just want to be knocked up because they're running out of time, and they want to get married to somebody just because they want to have. I'm serious.
it's so true though. I mean, but that's I mean, I love that we're headed in that direction is that there's also a cultural aspect of this that, I mean, my last book was called The Feminine Fertility Cure. It's really inviting women to stand in their power and not be ashamed of their desire to have a family. You don't have to check somebody else's boxes. You can have both. You can have a great career, you can have a family, you can do all of these things, but you have to let yourself have the permission to want what you want and not apologize for it. And certainly not be in a place where you're handing all of your power to somebody in a white coat that isn't even considering some of these nuances.
I agree with you 100%. By the way, you owe me a T-shirt. You said you're gonna send me a
I
T-shirt.
sent it to you.
I
We
didn't get
sent it to you. Oh, yeah. We'll check with Jessica because we sent it to your office.
unless Jessica stole it. I did not
I,
get it.
yeah, no,
I would
no.
have
Yeah.
worn it and took picture. Are you kidding me?
Are
I
you
didn't
kidding?
get it.
Well, I was one. Okay. We're going to sort this out because we sent that months
Okay, we'll
ago.
fight later, not on
Yeah,
air.
yeah,
We'll
yeah.
fight
No, we'll
later.
fight later. Yeah, no, no. It's totally okay. Yeah. You're going to be
Well,
wearing a
back to egg
fertile.
freezing,
Yeah.
Roseanne.
Back to
Back to
egg
egg,
freezing. But I mean,
back
that's
to egg
great.
freezing. Look,
Yeah.
another thing. Some doctors might hate me, but it's okay. I don't mean it in personal way. I see patients all the time who froze 20, 30 eggs. Then when they thaw them, none of them make an embryo, and it's devastating. I can tell you, this is a third example of high doses of medication being bad for egg quality. So, I highly recommend if a patient wants to freeze eggs, just be mindful of how much. It's not about the quantity, it's really more about the quality. And there are studies actually that it was killed, that study was published, but did not receive any media. The people who were doing egg freezing, they were not more likely to have children. And egg freezing, yes, the ASRM did not do anything about it. Look, there is, it's, egg freezing is important. All I can tell you is I see patients every single day who thought their eggs and never made any embryo, even though the sperm is perfect. So, all I can say is don't get too excited about the quantity, get excited about the quality. And my advice is those medications, 50% of the time, are actually toxic for the quality of the eggs.
So are you saying basically, Zaher, that if these women get slammed with all these drugs with the intention of doing egg freezing, if they're given too many drugs, the quality of those eggs may be no good anyway?
Yes, happy to share the articles with you. And
Well,
whoever wants to argue, please, I'm happy to have a professional Zoom all over the world and we can discuss it. We can go through the cellular mechanism and everything. It is bad and toxic for the egg quality. I'll just give you three examples. Women who wants gender selection can't even make an embryo, but they get pregnant naturally. Two, patients who keep having miscarriages. Now they can't even make an embryo. That's not their problem. They were making blastocysts in their own. And three, people who have egg freezing, lot of eggs, and not even one baby, and that's devastating. So my advice is don't get too much shots and freeze, focus on quality. I'd rather do multiple cycles slowly with gently than one pump them with all these drugs.
Holy cow. I mean, this is mind-blowing, Zahara, because I've heard this in my own practice. Women saying, "Oh, I frozen these
Mhm.
eggs back when I was in my early 30s," and then they think, "Oh, I've got, 20
Exactly.
eggs. I'm in
Uh-huh.
great shape." But then when they thaw them, nothing.
I see it every
Wow.
day too. Yep. But
Wow.
call me crazy.
Well, crazy like a fox. Like, what are some of the things that you would encourage women to consider in making a selection and making a move forward? Like, when they're trying to decide, do I want to do something more like a mini IVF, a more gentle IVF, or
Look,
going the standard route?
Roseanne, this is a great question. A lot of experts and geniuses like Larry Ellison and others, they're working on AI softwares right now to take blood from Roseanne and Merhi, run the DNA, and based on those, we'll decide which vaccine, flu vaccine, is best for you and for me. Because the same flu vaccine doesn't work for everybody. I can get flu vaccine and can still get the flu, yes? Same thing for vitamins. CoQ10, vitamin D, all those, I love them, but they work for some, don't work for others. Why? Because we're human and we have different DNA. So the future is taking blood from you, running it, and looking at it on the computer. Say, okay, Roseanne, you will benefit from CoQ10, NAD. Vitamin D is not going to help you. Zaher, vitamin D is going to, because we're different. Same thing with IVF. If you close your eyes and go to this, they're all gonna give you Follistim and Manipure. All of them. Same dose, 300, 150, whatever it is. And then, oh, my IVF lab is the best. It's bullshit. Your IVF lab is the best because you threw out all the patients with low ovarian reserve and you only kept the ones who have high pregnancy rates. What do you mean your lab is the best? We all use the same incubator. We all use the same air filter. We all use the same media. We all use the same embryologist. Embryologist was changing job in Manhattan during the pandemic every 5 seconds. Give them $1 extra, they'll leave you for it. So what do you mean your lab is better? If I say no to every patient with low AMH, and every patient who is overweight or every patient with fibroids, yeah, my pregnancy rates will be 100%. But what I'm trying to say is, it's to me, most clinics give the same protocol, and it should be customized based on age, ovarian reserve, FSH, number of follicles. And my advice is, I always compare it to diabetes. The higher your sugar, the more insulin you get. The lower your sugar, the lower the insulin you get to control it. Same thing. The more follicles you have, the more drugs you need to feed them. The less follicles you have, the less medication you need. So give it. Look, I have a patient who had 15 follicles. Okay, her FSH was 5. We made 3 beautiful embryos, genetically normal. She came after 4 months. She wanted to do another cycle. Now she has 5 follicles, not 15, 5, and her FSH is 12. So I cut the dose in third. She called me, Mary, what the fuck? Are you crazy? We did very well on this protocol. I said, well, 4 months ago, you had 15 follicles with FSH of 5. Now you have 5 follicles with FSH of 12. Can you tell me how am I supposed to give you the same protocol? How? It doesn't work. So she did very well, and we did. What I'm trying to say is, even within the same individual, I see patients like, oh, I want the protocol that made me pregnant. Well, you were pregnant 3 years ago and your baby is 2, and your body is different.
Yeah.
So
There's
I'm
no
not against
recipe.
I'm not against trying something that works. Don't get me wrong. All I'm saying here is, if one conventional cycle doesn't work, it's time to change. When I mean change the dose that food gives food. Don't add Lupron, Flare, and this and change the whole, because that food for the follicles they did not like. That's all I'm trying to say. And I
Yeah.
love everybody. I love
Yeah.
my friend doctors and everybody.
Well,
Yeah,
this is really about changing the conversation and opening it up and really encouraging people to think critically and not to get so stuck in their ways and to consider these different options. I mean, it's very clear that the tide is turning now. More people are becoming more savvy. More people are taking a more whole body approach to this. Like if you want to support your IVF cycle, whether it's mini or conventional or whatever combination of things you're doing, you can't ignore the mind inflammation, the body inflammation, all of these things. In order to create success, you have got to hand your team, including your physician, great basic things to work with. And it positions you differently and you can become a partner with your doctor. It's a collaborative effort, and the more educated you are, the more you can support them in working their magic.
I agree with you 100%. But look, Roseanne, you're not just an egg and a uterus. Okay, you are
Definitely
a
not.
whole body. First of all, it starts here. The brain produces FSH and LH. So the brain starts here. And yes, stress changes these hormones, right? A lot of people with stress, they skip periods because of the stress. Go now run marathons. You don't get periods for 6 months because you're stressed. What I'm trying to say, it all starts here, right? That's the brain. Then, two, everything else is related to make a good egg and uterus because your body is all connected with each other. Diet is related to stress. So many things is related to make egg, good and implantation good. What I'm trying to say is that you're a body or human that a lot of signals are going to your ovaries and uterus, and not just an egg and a uterus. You can't just treat them like that, and
Yeah.
you need to optimize the issue, right? Yes,
Yeah, I
they
mean,
tell you exactly. You tell you unexplained infertility. We're great, but what does that mean, right? There are reasons that we haven't really discovered. But
well,
again, think about the person as a whole, not just as an egg and a uterus. That's all I'm trying to say.
and that's super smart, Zaher, because that's the thing. Like, if that was the case, if it was just egg, sperm, uterus, we'd do one cycle of IVF and we'd all be done. If it was that simple.
Yep.
Zaher, thank you so much for coming on. These are such powerful conversations, and I love your courage. I love all of the excitement and the true commitment that you always show your patients and the community at large, whether they're
I
your patients or
appreciate it.
not. Like
I
it's
appreciate it.
that kind of education and that kind of courage that I think is really changing the conversation. So thanks for
It's
coming on.
always a pleasure seeing you on Instagram, following you. I always comment on your stuff. I don't know if you see,
I
and
do.
it's always fun talking to you. You're so energetic and positive. And let me tell you, um, it's rather fun. I'm really honored to know you. That's all I can say.
Same, Zaher. Loves, wasn't my conversation with Dr. Merhi absolutely eye opening? I hope you paid very close attention because if fertility success just came down to having a bunch of treatments and popping a bunch of pills, we'd all do it once and never have a problem. But we know that the mind and body have to work together. And I love physicians like Dr. Merhi who really get that and emphasize it. So be sure to check out Dr. Merhi's work. We have a link to Rejuvenating Fertility Center in the show notes. And look, even Dr. Merhi will tell you that your mind is half the battle on this journey. And if yours is focused on fear, doubt, negativity, shame, jealousy, and all of that nonsense, you are not creating the best possible circumstances to get and stay pregnant. So if you want my help with that, go to www.frommaybe2baby.com and apply for an interview there. My methodology has helped women around the world make their mom dreams come true, and their results speak for themselves. Till next time, change your mindset, change your results. Love this episode of the Fearlessly Fertile podcast? Subscribe now and leave an awesome review. Remember, the desire in your heart to be a mom is there because it was meant for you. When it comes to your dreams, keep saying hell yes.